thank you. Yes, feels like eternity since the last episode, but here we're back again. You're welcome. The man on the hot seat, representing the National Health Insurance Scheme, then was Dr. Femi Thomas, the Executive Secretary, CEO. He made a promise to us. You want to hear it?
Yes!
Thank you. He said to us that he would cover 40% of Nigerians by 2015. Sounds ambitious, isn't it?
Yes.
So, ladies and gentlemen, welcome the Executive Secretary, National Health Insurance Scheme, Dr. Femi Thomas. You're welcome.
Oga, I'm here again. And you're here again.
It's nice meeting you again.
Please raise your right hand. You promise to tell the truth,
And
the whole truth,
and
nothing but the truth. Akin, over to you.
I need you to tell us, what programs do you have in place to achieve 40% coverage of Nigerians on health insurance cover by 2015?
Akin has just asked me how we tend to achieve 40% coverage in terms of health insurance for Nigerians by the end of 2015. First, I reaffirm that it's doable. The President of Nigeria, His Excellency Dr. Ebele Jonathan, had directed the Council of NHIS to cover at least 30% of Nigerians by the end of next year. Having done our own homework, we've done the situational analysis, we do like all the opportunities around us and all the possibilities, assessing our strategy, we believe that we can even surpass this. And that's why we're offering to take us to 40% coverage come 2015. The truth is that we've done all that we had to do in-house in terms of restructuring. We've done all the personnel shifting that we have to do, and we are already deploying the strategy towards that. As I'm talking to you, we operate from all the states of the Federation.
Universal health coverage is the ultimate goal of health insurance.
Yes, everywhere in the world now.
Nigerians on health insurance are below 10%.
Yes,
as we speak.
Single digit.
And financing has been a major factor. What are your plans to woo investors to believe in this, to buy into your vision, and ensure that Nigerians are enrolled?
The greatest asset that we can have in this particular game that we are talking about is advocacy. Advocacy is like telling people to do what they already know. It's about reminding them to do it at this time. It's about telling them that the time has come for us to do this for our own sake and for the sake of the people that we all serve. Presently, you can see the high-level advocacy that has happened at the federal level. You saw Mr. President organizing a presidential summit, mobilizing all the stakeholders in the National Assembly, in the ministries, in the international community, World Health Organization, the World Bank, the Joint Learning Network, all sorts of people. All of us came to Abuja and we came up with a declaration telling the whole world that Nigeria is set for a journey on universal health coverage.
My wife fine o, she no get part 2. She fine pass oyinbo queen, no rival.
Baba, your wife is coming.
Hospital bill.
Da kin yi register da NHIS. Da yanzu ba kya asibiti bill. Ìbá ṣe pé wọn náà ti darapọ̀ mọ́ ètò ìlera adójútòfò NHIS ni. Ó ní máa pariwo owó hospital.
Ọ bụrụ na ị dere aha gị n'akwụkwọ ndị NHIS, ị gaghị nọrọ ebe a na-eti mkpu the hospital bill.
And my dreams dey always come true. I dey go register for the NHIS.
You go school? Wetin you know about SEs?
Na NHIS government don dey arrange better thing wey you go benefit from. Me and Linda, we no go dey suffer for hospital bill again. I dey go register for the NHIS now. Everybody can register. Bus driver, mechanic, trader, anybody.
Easy access to healthcare for all.
My name is Dr. Azun Amos. We're talking about asthma today. Asthma is an ailment that affects the respiratory tract. By that I mean the breathing part of the body. It presents with difficulty in breathing. That is the main thing in asthmatics. They could have runny nose, they could present with catarrh, amongst other things. Talking about the causes, you exactly cannot say this is what causes asthma, but it's been found to be hereditary. That is, if a father or a mother has it, one could develop it. Sometimes too, it might not be traceable to any family source. Management starts with knowing what provokes it, if you can, and preventing it. For instance, if you live around a dusty environment, if that provokes it for the patient, avoid that. If frying fumes sometimes can trigger it, if you prevent that, that could stop it. And if any other thing you can do that, then you use drug. And when it's very bad and the patient is not getting better, for instance, you might need to take the patient to the hospital where intravenous or sometimes IV fluid might be given. Thank you.
I've heard about pool. I've heard about government participation. I've heard about this. But I'm sure all the people watching now, what is in their head or what is on their tongue tip is, Nna, egole. What is expected of Kamaru, Saka, Adija? What am I supposed, Gbenga, what am I supposed to pay?
Right.
When do I pay it? How do I pay it? And why? And when I pay it, how long does it cover me for?
This is a very, very practical question, which is very fundamental.
Sorry,
and that's
the truth.
And nothing but the truth. The fact is that this funding thing, this contribution that we are talking about, comes under different programs. In the public sector program, which we currently run, the federal government is paying 3.75% of our salaries. Workers are supposed to add 1.75%. You see, so small to it. That means if I'm earning 100 naira, all that people are asking for is 1 naira 75 kobo, which is so infinitesimal. And with that, I'm covered. My wife is covered. 4 children under the age of 18 will be covered. Can you see? That's wonderful. Go to our website, you see the guidelines for that, buy this card, register, and all sorts of things. Then we have community-based health insurance programs, which have been undergoing a lot of piloting over the years. I think presently we have it in like 7 states or more, all covering at least 3 local government areas already. This is something that we are thinking we should expand to cover many locations as well. What that entails is that this is a scheme that is run by the community. The community members themselves will run the scheme. We only give them technical assistance. And what we do is organize them into a cell, mobilize them. A lot of advocacy, they build all this around a particular health facility, be it public or private. And they make small contributions, small donations, in some places as small as 300 naira a month. They contribute all this to the center, and there they access health free of charge. at least with this small amount, you cover pregnant women, so that women will no longer die during childbirth, and you cover for primary level diseases. All those.
There is a question burning my mind, and I'm sure I speak for the generality of Nigerians. Once your NHIS covered and you go to the hospital, there's always this relegating to the background of patients. It's more like anyone on NHIS cover is not respected, and there's that lowering of self-esteem. What control mechanisms are you putting in place to ensure that any NHIS compliant patient is respected in the hospital?
Right. Thank you, Akin. Well, I think your question actually explains the main reason why the perception of NHIS is not exactly the way we want it to be. Because this is a company that I've heard of on many occasions in the past, and we have been trying to address all this. One thing that is clear is this: no matter how good a program is, there are people who will introduce sharp practices, trying to see how they can get some extra benefits which they don't deserve. You can't run away from the good, you can't enjoy the good side of a scheme, and then when it comes to that small area where you're supposed to play your own part, you begin to dilly-dally. One thing that is clear is that capitation for a release is paid quarterly upfront. We pay quarterly upfront. As I'm talking to you, in the next 48 to 72 hours now, we are going to release capitation for the next 3 months. So anytime the enrollees now need service, they go there to access service. They don't have to be billed in any form. That is the agreement as it is today. But what we are seeing now is that some facilities, after taking this money, will now be trying to cut corners to give inferior service to the people that we have paid for. And that's the problem that we are trying to address here. What I tell you,
Can I ask a question?
yes.
Is it possible to terminate the contracts of this?
I'm going to that.
Okay.
I'm going to that. What we have done when we came was that we did an assessment of even the HMOs themselves.
Okay.
And we found out that only about 1/3 of the registered HMOs are healthy financially. So if the person is supposed to be regulating or moderating is not healthy, you can be sure that even the moderator can be moderated. And so they are the people who should actually be monitoring the facilities to make sure that things like this do not happen. But one thing that we do now is this: just as we are monitoring the HMOs are monitoring the facilities, we are also directly monitoring the facilities.
Thank you, Dr. Thomas. All right, Nigerians. It can't be all bad about the National Health Insurance Scheme. We put Dr. Thomas on the spot all day, and he has given us a promise that HMOs will be called to question because Nigerians must access quality healthcare.